Bismillahirrahmanirrahim. My name is Dr. Fakhriyat. You are watching our YouTube channel Medicos Viewer. Today we will discuss the most important topic of the eye is the visual pathway, direct and indirect light reflexes. All we will discuss about the visual pathway. What do you know about the vision? Vision, we can see anything towards our right side, left side, up, above by our eyes. This is called as the vision. By the we can see anything in front of us is called as the vision, and this is called as the visual pathway. Here, this is the right side. When I discuss visual pathway, this is the left visual field. Move toward the retinal side of the eye. Here, this is the eyeball, socket of the eyeball. This is the eyeball, and these are the retinal side. This is the nasal retina on the nose side, and about the temporal side, this is called as the temporal retina. Here, this is the temporal retina. After entering into the brain, it moves toward the optic nerve. Here it is the optic nerve. Then it moves toward the optic chiasm. What is the optic chiasm? Both optic nerve they decussate here. Decussation starting about the optic chiasm. Then move toward the lateral geniculate nucleus. Then move toward the primary visual cortex. Here this cortex is called the primary visual cortex on the occipital region. Then the vision starts here. The vision we can see about that area, and we can watch anything about the visual pathway. The most important next is the direct light reflex and the indirect light reflex. The name represent direct light. If we want a light on the right side or the left side, there is a reflection phenomena. Here we want to discuss about this is a normal eye. Here it is an also normal eye, but we are watching through the light. Here we are watching through the light. There is a pupil. Here this is a pupil. You want to watch about the constriction of the pupil. Here about the constriction of the pupil due to the light. This is called as the direct light reflex. By just imagining, this is I am watching on my right side. This by the light, this is called as the direct light reflex. After the light, there is a constriction of the pupil. This is called direct light reflex. Other is the consensual or indirect light reflex. If there is a light reflex on the right side, but I am watching on my left side, there is a constriction of the pupil. This is called indirect light reflex or consensual light reflex. We're gonna just by diagram what is the indirect and direct. There is a big difference between direct and indirect light reflex and visual pathway. Visual pathway just about the optic nerve, optic chiasma, then the optic tract, then the lateral geniculate nucleus. But in case of the direct or indirect light reflex, they do not involve lateral geniculate nucleus. If they do not involve the lateral geniculate nucleus, they will just move through the pretectal area of the midbrain. Here it's the midbrain area, and this is the superior colliculus, move through the pretectal nucleus. After entering into the pretectal nucleus, there is also decussation and move through it. Here you wanna watch about the pretectal area. It moves toward the right. This is the left Edinger-Westphal nucleus. This is the right Edinger-Westphal nucleus. Then it moved toward the right ciliary ganglion and the left ciliary ganglia. Then the post-ciliary fibers move through the pupillary sphincter muscle that constrict the pupil. We are watching here. This is the, if there is a light on the right side, there is a constriction of the right side. This is called as the direct light reflex. If light on the right side but constriction on the left side, this is called indirect or consensual light reflex. Here the most important, we discuss about the visual pathway, about the vision, and about lateral geniculate nucleus, primary visual cortex. And next we discuss direct light reflex, indirect or consensual reflex, and their pathway, which is the most important about the pretectal nucleus, Edinger Westphal, then the ciliary ganglion, then the pupillary constrictor muscle and constriction of pupil. Thank you so much. Jazakallah. Allah Hafiz. Please like and subscribe our channel Medicos Fever and press icon of the Medicos Fever. Thanks a lot. Allah Hafiz.